Okay, so imagine this. You've had 3 yeast infections in the last few months, or maybe it feels like you've had an infection, but when it's checked, you're told there's no infection, or maybe sex starts to hurt, so you avoid intimacy, or maybe you notice that you're leaking a little more when you laugh or you cough. You go back to your doctor and you're told, well, everything is normal. It's just part of, you're getting older, you're a woman, whatever. So if you have been chasing creams, you've been on antibiotics a lot, and you're still not getting relief, or you continue to have symptoms despite treatment, this episode is for you. I'm Dr. Adelola Ashaye. I'm a board-certified family medicine and lifestyle medicine physician and owner of InTouch Primary Care in Sugarland, Texas. And you're listening to Connecting the Dots with Dr. Ashaye. If you or your loved ones are in Texas and you've been putting off care due to healthcare frustrations, or maybe you are seeking a more personalized approach to your health, I invite you to check us out at InTouch Primary Care. We're dedicated to making high-quality care both accessible and stress-free. So let's dive in. And today we're going to be connecting the dots between your symptoms and what might really be going on, hormonal shifts that affect vaginal and bladder health. But don't forget to subscribe, share this with a friend. If you've listened to the last episode, it's been helpful. Book a visit with us and start your health transformation today. Okay. So dryness, leaks, discomfort, it might be hormones. So it's important to know that when hormones like estrogen, progesterone, and testosterone drop, which happens in menopause, or can also happen with medications, stress, the tissues in the vagina and the bladder change. So that's really important to understand. They become thinner, less elastic, and less protective, so you're more susceptible to irritation and infection. So this means people start to feel dry. They feel like the body is no longer producing natural moisture. Some people have itching and burning, especially around the opening of the vagina. Some people feel like that area is tight or sore during sex. Some have irritation, even when they're just sitting or walking. Some have infections, so where they're getting now more urinary tract infections, yeast infections, and other vaginal infections that maybe are treated or maybe feels like an infection, but when they're tested, they do not have an infection. And unfortunately, the bladder does not escape these changes either. So some people will start to feel more urinary urgency where they feel like they have to go to the urge to urinate more often. They may also have some leakage when they cough or when they exercise. They may notice it burns when they urinate, but when they check a urine test, they do not have an infection, or maybe now they're actually getting recurrent urinary tract infections. So unfortunately, many women that have these types of symptoms are not told that the real issue may be hormone related and that these symptoms can be caused by hormone related tissue changes. And so some may be told, oh, you don't have an infection, and then nothing is done. So as we discussed on the last episode, while this is very common during the perimenopause and menopause stage in a woman's life, it can actually happen at many different stages in 20s, 30s, 40s, because if there is anything that shifts your own hormones during that period, you can have some of these changes. And you can listen to our last episode to get more information about when these types of changes could happen, examples of hormonal shifts like during breastfeeding, for instance, or taking certain medications and so on. So hormonal causes. So what if you are like, yes, that's me. I'm experiencing some of the symptoms, many of the symptoms, few of the symptoms. What can I do? Well, the first thing I would recommend is keep a journal, keep track of when the symptoms started. Try to keep track of what makes them better or worse. Keep track of medications, especially birth control pills or even antidepressants, anti-anxiety medications that you might be on. Keep track of breastfeeding stress in general also. And bring that along with you to your appointment with your menopause-informed or hormone-informed doctor, and that will help us get to the right diagnosis and treatment. So treatment, that's what we're going to be talking about in our next episode. There are many options for treatment. There are creams, there are inserts, there are rings, there are non-hormonal pills even. There are even options for people with breast cancer, with a history of breast cancer, and we're going to break that down in simple terms. So don't miss it. Go ahead and hit that subscribe button, share this with a friend, and remember, symptoms are valid and you deserve real answers. And again, if you're in Texas or you would like to make an appointment, you can contact us through our website or you can call the number listed. And we will see you next week. Thanks for listening.